Hi everyone, and thank you for joining us here today on TIP International Radio. I'm your host, Leah Maston. We are showcasing prestigious top professionals from all industries all over the globe to share their experience and stories of success. We have a very special guest joining us today from Canada, who is a world-renowned pediatric dentist who is widely known for his expertise in educating his patients and families of the effects of early childhood caries. He is also the former owner of his private practice, Dental Care for Children, and founder of two nonprofit organizations. He was just recently honored at the International Association of Top Professionals, IAOTP, Annual Awards Gala at the Bellagio Hotel for his selection as Top Pediatric Dentist of the Year. Everyone, please welcome Dr. Leonard Smith. Hi, Dr. Smith. Thanks for joining us today.
Pleasure. Thank you for having me.
So, Dr. Smith, you have close to 50 years of experience as a seasoned and trusted pediatric dentist. Tell me, what first got you started in this industry? Was it always a field you were interested in?
It was, even going through dental school, I enjoyed working with the children and I enjoyed their honesty and the challenges that they presented. And it's just continued to grow in that fashion.
So you're definitely right where you're supposed to be.
Yes, ma'am.
Well, you have such an impressive repertoire of prior roles, including president of the Academy of Dentistry for the Handicapped, chief of the dental department at the Alberta Children's Hospital, and clinical assistant professor in the Department of Pediatrics at the Faculty of Medicine at the University of Calgary. Now, your main focus is on your two nonprofits and educating the public about childhood caries. Tell us about that.
Well, over the years, in our community in Calgary, I noticed an increase in the number of children coming in with severe dental disease and coming in at an earlier age. Sadly, we see children as young as 11, 12 months of age with extensive decay. And some of the other issues that go along with that is that these children start developing toothache at that early age, and they can't obviously communicate the pain with words, so they communicate with crying and fussiness, and that leads to potential, as the disease gets more severe, a greater impact to the child's neural development, to their livers, to their whole body, essentially.
Right.
And in addition to that, it's also associated with domestic violence. In certain dysfunctional families where the child is fussy all night and the husband can't get the sleep that he needs, he blames the mom, and it's her job to look after the kid, etc. And it's documented that domestic violence is a serious issue associated with this totally preventable disease. So I formed the not-for-profit, both in Canada and the USA, to develop educational tools to teach the children why their mouths are so important to their whole body, and as they grow, to teach teenagers about this problem so that when they become parents, they'll have a better understanding and get rid of the idea that baby teeth are only there for a short period of time. They're going to fall out, so why care about them?
Right. Well, that's incredible, the educating that you're doing and the difference you're making in this specific area. With this day and age, with so much going on in the world, we have to overcome some huge obstacles. What has been your biggest obstacle and challenge that you've had to face, whether in your current position or prior to your position, in order to pursue your goals?
Well, it's the simple statement is that people have the attitude in many areas of the world, including North America, that baby teeth are just that, and they're there for a short period of time. Therefore, why be concerned about it? And they don't link the mouth to the rest of the body. And really, the mouth is the gateway to our bodies. And if our mouth is not well, very likely the rest of the body is not going to be well either. So, and then, it's even more frustrating for parents who have special needs children, because when you have a child with special needs and they do develop this disease, it just exacerbates some of the problems that they're dealing with and makes it much more difficult for them.
Sure.
And for
Well, you have just a wealth of experience in this industry. What would be some advice that you would give to someone starting out in pediatric dentistry?
Well, essentially, getting the attitude that they're dealing with a whole person all the time, and they're dealing with families, and becoming aware of that relationship, that it's more than just teeth. And it's not being taught in medical schools, it's not being taught in social work schools, and even in the legal profession. This information isn't being shared because it falls in all these areas: if child neglect, child abuse, spousal abuse, etc., etc. And it really comes to the fact that the parents, and it really usually falls on the mothers, haven't been educated on the importance of preventive care, limiting the amount of sugar that's in the baby's mouth. And sadly, the amount of sugar that's in baby formula and the amount of sugar in apple juice and other liquids is unbelievably high. So the children are being exposed to the sugar almost from birth or within the first few months of their life. And the sugar that's the major participant, if you will, or product that the bacteria in the mouth use to produce their food, and then they have a waste product, and it's lactic acid, and that's what causes the disease. So teaching all parents how easy it is to prevent the problem is the goal of should be the goal of every professional who interacts with families and with children in any way, shape, or form.
Absolutely. And it's interesting too, because I would think a lot of parents think apple juice is healthy for their kids and they're doing something good for them, but here it's chock full of sugar.
Well, sugar is an addictive agent.
Yeah.
And they've done some studies to show that the dopamine levels in children rise when they're getting sugar, and dopamine is like a high,
Sure.
Neurologic high. And so the children get hooked on that, and then a mom wants to be a mom and love her child and do the best for her child, and will feed the child with all night long, and not know to clean the gums even before teeth come in, and not know to clean the teeth, and aren't being shown how easy it can be done so that it's efficient. And you eliminate, just with preventive care, probably, and this is just a guess, probably 90% of the disease.
Wow.
And at no cost to the parents.
Right.
So it's tragic, and in a lot of places in the world, access to oral health care isn't there, or in rural communities, and some professionals who are in those areas aren't familiar with how to deal with these children properly. So dental disease in children under the age of 5 in North America is the most common chronic infectious disease there is. It's the most common surgical procedure in Canada in all the children's hospitals.
Wow.
And the statistics just get worse as you look from country to country.
Well, the work you're doing to educate and raise awareness about this is so important and incredible. Throughout your illustrious career, you have won numerous awards, honors, and featured in magazines worldwide. This past year, you were honored at IAOTP's annual awards gala at the Bellagio Hotel for your selection as Top Pediatric Dentist of the Year. And this year, you will be honored as Top Pediatric Dentist of the Decade and receiving the Lifetime Achievement Award. That's quite amazing. I know you'll also be featured on the famous Reuters building in Times Square, and we're on the front cover of Tip magazine. Congratulations. What would you say has been the highlight of your career or most memorable experience that you've had to date?
That's a tough one. I think just seeing the highlight, actually, as I think back on it, is the privilege I've been given to treat multi-generations of families within the practice. And it's exciting to see that I treated a child 40 some odd years ago, and now I'm treating their grandchildren.
That's incredible.
So that's exciting.
Yeah, that's definitely rewarding, those long-term relationships.
Yeah, and it's also very interesting to see the very low level of disease in the third generation.
Right.
So the message is getting out there. But
absolutely.
My goal is to send the message out on a global basis so more people can hear and stop at least one problem that the children have.
It's amazing. When not working, I know that you have some hobbies. What do you like to do for fun?
I like the outdoors. I'm blessed with a wonderful wife who's very dynamic. She's a poet, a singer, and an artist, and two wonderful young ladies. And I have two grandsons, and they're growing up quickly, and it's fun to be able to share life with them, with all of them.
Yeah.
We like to travel and visit and see and just enjoy in that time.
Family time.
Yeah.
That's great. Looking back, what would you say that you attribute your success to?
Well, I've alluded to it before, is to see the positive results in the families I'm treating, and just to enjoy being supported by a very great family and friends surrounding, and all supporting one another in a healthy lifestyle that we're privileged to have.
Well, we're so lucky to have you doing the important work that you're doing. And I just want to thank you so much for your time today.
My pleasure. Thank you.
And please, for more information on Dr. Leonard Smith, you can visit www.drleonardbarrysmith.com.